Hi, Dr. Amy Mercovich here. This class is to help you to understand how your body works so that you can take the best care possible of yourself and your family. So let's get right to it. My first question is, what is health? It's why we're all here. So what is health? Let's define it. And I'm going to give you a hint. There's a small word within the word health. So health is your body's ability to heal. Now, if we bring that down to one more level of its lowest common denominator, what does it mean to heal? Well, what to heal means is that your body can find things wrong and fix it with new cells. We call that cell regeneration. So your body's health is the fact that your body can do these processes. It can heal. It can make new cells. Your body can find things that are wrong and fix it. This is just so important for you to know, because health does not mean that you don't ever have symptoms. You will sometimes have symptoms. Everybody gets a cold now and then, or you drop a rock on your toe and it hurts a lot. You're going to have pain at times. You might have achy joints at times, but if you're truly healthy, it means your body is functioning properly and it can make new healthy cells. Now, my next question is, what controls this process? So what's the one system of the body that controls all the other systems? The answer is, if you said the nervous system, you would be right. So your nervous system is made up of the brain and the spinal cord running through the spine, and then all of the nerves of the body. And they go everywhere. So the nerves go everywhere. Every cell, every organ, every tissue, every muscle gets a supply by a nerve. So health is your body's ability to heal. It's controlled by your nervous system. Where does a lot of your nervous system live in your body? If you said your spine, you'd be right. Your spine is where a lot of the nerves of your body live, and almost all of the nerves have to go through your spine to get to the other parts of your body. For example, a message from the brain to tell your stomach how to work goes from the brain through the cervical spine, the neck, through the upper back, and then a branch is going to come out between the bones of the spine and go to your stomach. And then a message from the stomach to say how it's doing is going to go back up that same path. So it has to go through the spine to get there. Same with anything to go down your legs, down your arms, all your organs, and your immune system is affected by that nervous system. So the nervous system controls all the other systems of the body. It happens to live inside the spine, so therefore our deduction here is that the condition of your spine can affect your health. Now, I think understanding that is a very important thing. Now, what I want to do is shift gears a little bit and talk about the two different health paradigms. So we chiropractors like to use the phrase ADIO, and I'll explain what that is in a minute. And then we have the medicine paradigm. Now, the point here is not to slam medicine. It's to teach you how to take best care of yourself and your family so that you kind of know the secret to how to have the best quality of life possible. So medicine, there's a paradigm of medicine, and what that paradigm is, by paradigm we mean a set of beliefs. So what's the underlying core belief about medicine? Well, it's that for every condition, so one condition or disease or whatever you might have, or symptom, okay, the smart scientists sit at a round table and try to figure out the what that will help that condition, disease, or symptom. And if you fill in the blank what that what is, if you said drug, you would be right. So the paradigm is that for every condition we can come up with, or disease, we want the drug that'll fix it. We want to be able to say, oh, you have this condition, let's look at the dotted line and see what drug is supposed to fix it. Now, in theory, that is a perfect solution, but it has a fatal flaw. And what do you think that fatal flaw might be? Well, let's flip this back around. What did we say health was? Your body's own ability to heal and fix things and make new healthy cells. So if you have the symptom and you take the drug that's supposed to help that symptom, does it make you healthier? Okay, that's the fatal flaw, is it does not necessarily make you healthier. It might change that symptom, but it hasn't done anything to fix or to make this system work better. So that's the fatal flaw for using medicine as your long-term health care. There is a great place for it that we'll get to in a minute. Now, above, down, inside out is what ADIO stands for. And we chiropractors like to say that because that's how we describe how the body heals, from above, down, inside, out. And the messages have to constantly go from your brain to your body and your body to your brain. Now, chiropractic is obviously on this list of things you can do that help your body heal from the inside out. So this is all things that tap into this way of healing, that your body finds things wrong and fixes it with new healthy cells all on its own. Let's add to this list. What else could go on this list besides chiropractic as a really good foundation for your nurturing your body from the inside out? Well, food. Because what does our body have for raw materials to make new healthy cells? Well, only what we put in it. Things like our fish oil and those omega-3s and vitamin D. So I would say food and some supplements, because you can't get everything necessarily in your diet. For example, I take fish oil and vitamin D and probiotics, and I give those to my children too, because we just don't tend to get enough of those. I happen to love sardines, but most people don't. I can get a lot of fish oil into my diet by eating a can of sardines several days a week, but I don't think there's too many people out there who do that. So food. How about movement, exercise, activity? And this doesn't always have to be get sweaty, put special clothes on, exercise, just movement of the body. 90% of the stimulation of your brain comes from your body's movement. And of that, 60% comes from movement of the spine. So very important to stimulate the brain, and all the healthful activities of the brain is to move the body. Now, we could also put on this list a positive mental attitude. That's been certainly shown in studies to make a difference in people's health. Love, relationships, that's definitely been shown to lengthen people's lives when there's good quality relationships. We could put on this list acupuncture. Again, it's tapping into the body's own ability to heal. Acupressure, maybe Chinese herbs. If we could add some other things to these things to this list, that's allowing the body to function better from the inside out. Okay, now here is the moral of the story. Now, we are taught generally in this country to use medicine as our health care, but it's not truly health care, it's actually disease care. And we tend to do that 95% of our time. Not me, but in general, people. And then they do things like this maybe 5% of their time. And my challenge to you is to perhaps flip-flop this so that you're doing the above, down, inside out techniques. You want to be doing this most of your time, 95% of your time, and this only 5%. And now let me tell you what this 5% might be over here. What is it that could happen to you that you are so happy that there is a great hospital emergency room around, maybe within 30 minutes, no matter where you are? Well, what could happen to you is you could have a trauma. So a trauma could endanger your life so much that you couldn't possibly get your own body to find everything wrong and fix it on its own. You would die first. So emergency medicine is especially important to have this disease care paradigm. So we're really grateful we have this. So for emergencies where you need the drugs, the surgery, the whatever, if you're burned, you're in an auto accident, you have a fall, your appendix bursts, all different things, you get maybe an infection that's so bad that's overwhelming your body. And then as soon as you get that taken care of, you want to jump back over here and get your own body to take care of it. Now, there's a great analogy about this. And what that is this is sort of like the house is on fire, okay? So let's imagine that the house is on fire. And who do you want to call? Not Ghostbusters. You want to call the fire department. We happen to be right across from one here at Bergen Family Chiropractic. So we want that fire department to come with their axes and their hoses, and they're going to chop through walls, and they're going to break through doors, but they're going to get the fire out. That's medicine. That's what you want. That's how you use this system of disease care when something terrible happens to you. And then, once the fire's out, who do you want to call then? Do you want to call the fire department again? Because they have axes and hoses. Is that going to help you? No, you don't want to keep doing that, because at that point you want the cleanup crew. You want the carpenters and the plumbers and the electricians and the painters and the decorators. So it's built back up into a beautiful space. That's above, down, inside out. That's where chiropractic fits in. All of these other things, taking really good care of yourself. So you go here, you jump here when you need it, and you live over here in these activities. And to me, that is the moral of the story. That's how you take the best care of yourself, how you take care of people in your family, so that you can help to educate them to do the same thing. Now, just to end with my story, I was a kid who was very sick all the time. I can remember second grade. You're so excited when there's an Easter party and a birthday party and a Christmas party, and I was always sick, and I was so disappointed that I always had to go home on those days because I was sick and couldn't participate in the parties. So I had a lot of ear infections. I got every weird skin condition you could possibly get, and I had terrible headaches. Then move forward a few years, I'm in my preteen years, and I have terrible upper back pain. Someone finally tells my mom about chiropractic care for her own back problem. She goes, it helps her back problem, it fixes her chronic heartburn that she always had, not even knowing those were connected, and she takes me to the chiropractor, and it changes my life. I never get headaches anymore. My back doesn't hurt. I get adjusted now for wellness, and that's how I care for my family, and obviously made a big impact. My mom and I are both chiropractors here, and we see stories like that all the time. If you have someone in your life who you feel like you want them to get the benefit of chiropractic care, and you would like them to get a nervous system assessment and a posture assessment here in our office, then use the code Adjust for Life 1. Okay, if you tell our receptionist Adjust for Life 1, you have that person call and say that code, then they will get $10 off their initial appointment as our gift to you for taking the time to learn these things. And I hope you have a great day.